Okay, for the different grades of mobilization, first we have a grade 1, which this is going to be just right at the start of the range of motion, and it's going to be a low amplitude, so it's going to be small but like a quick oscillation right at the beginning of the joint range of motion. And then for grade 2, we're going to do that's going to be a high amplitude movement, so it's going to be larger, but it's going to be from the beginning of the range of motion to the mid range of motion. So you're going into the mid range, and it's going to be larger. So as if like if the table is representing like the range of motion for the joint capsule, the first one would be just like a slow and small, not slow, but small range, and then for the second one, you're going to go larger. Then for grade 3, you're moving from the mid-range to the point of limitation. So that would be an even deeper movement, and it's also going to be a larger amplitude, so a like bigger range. And then for grade 4, it's going to be a small amplitude, and you're moving right at the point of limitation, right in that plastic range of movement to do like small oscillations right at the end. So that would be like if you're pushing all the way in on that, right at that end range of motion. Okay, for this video, we're gonna do some talk about joint mobilization. So there's 5 different grades of joint mobilization. The first 4 can be performed by athletic trainers, and but we cannot complete the 5th joint mobilization. So the first 2 are going to be to help with pain and spasm, and then the last 2 are going to be to help with increasing range of motion and just overall like joint flexibility. So for this, for shoulder mobilization, we're going to do the posterior and the inferior capsule. So you're going to have the patient relax and stabilize in their armpit with your first hand, and then with your other hand, you're going to place just off on the humeral head, and then you would push down for the posterior capsule. And then for the inferior capsule, you're going to move them more into abduction and stabilize again in the armpit, and then have the other hand on the top, again, just on the humeral head, and then you would be placing a downward force for the inferior capsule. For joint mobilization of the knee, we have the anterior and posterior capsule mobilization. So for this one, you can move the patient into, go ahead and relax for me, into flexion, and then you're going to try to get them relaxed as possible so that you don't have the hamstrings interfering on keeping it for the tibia from moving. But in this one, you would stabilize here and then provide a force this way, moving towards the table or pulling out for the anterior capsule, and then the downward would be the posterior capsule. Another and more comfortable way to do this mobilization would be to have their legs straight up on a half foam roller. So this would be kind of the stationary, and then you would provide the force on the femur pushing downwards to do the posterior capsule.